Climate change and catastrophic natural disasters threaten the lives of millions of people. It is very likely that new pandemics will emerge because of climate change.
But climate change has as well its impact on already existing pandemics. The successes of the past decades are in danger of being undone. This concerns the fight against malaria, tuberculosis and HIV, but also against other neglected tropical diseases.
Without interviews, we contribute to a discussion around the impact of climate change on global health, the work of the Global Fund, health and community systems, resilience in marginalized communities. The Sustainable Development Goals will certainly not be achieved. The link between climate change and pandemics continues to be misunderstood, neglected, and not counteracted.
Climate change has really exposed the inequities in the world and sub-Saharan Africa, and my country is one of them, in Africa. The challenge of climate change has really exposed us. I said inequities because it has really affected the population that is more advantaged, the young people, adults, and everybody. In Ghana, climate change has increased food security. We don't even get the food, and all the gains that we have made in disease, public health, has been eroded. And we have to start all over again because a lot of things have gone back. And the catastrophic challenges that we have, which I've been talking about, has exposed our health systems. It has exposed the environment. A lot of unpredicted diseases have come. Every disease have really increased, looking at it from the health point of view linked to climate change. Climate change has affected the poor, the farmers. The environment has become very unpredictable. Heavy rain, famine, disease, all over the country that I come from. So I'll talk about malaria. Climate change, you know, the weather where mosquitoes breed, the Anopheles and all types of mosquito breed in environment that we have now due to climate change. Because of that, we have unprecedented increase of malaria, affected women, children under 5, and the whole population. So malaria case incident has increased, malaria death, mortality has increased, and all the gains that we have made as a country have gone back, and we have to start all over again. I talk about TB. You know, there is a lot of airborne diseases, and so because of the weather related to climate change, there is very fast spread of TB. And so because of that, we have really had a big challenge increasing in TB cases and multi-drug resistant TB because a lot of people don't have money to even get to the health facilities. Children don't have that. So families are more together because of the weather, and because of that, there is very fast spreading of TB in the families. Now, when it comes to HIV, it's the same. Because of climate change, a lot of people cannot go for their ARVs because of the weather, and poverty has increased. You know, it has affected the poor especially because many of them are farmers, and because of the weather, they cannot produce a lot of food, and because of that, nutrition has gone down more among people living with HIV, TB, and as a result of that, all the gains that we have made with support of Global Fund and all other partners has gone down, and we have to start all over again with very limited resources, because if you see how the world is now, it is very difficult to get resources. Global Fund is unable to mobilize its 18 billion to even reach out to the countries. USAID and all other partners are supporting. Many governments are not able to support and increase domestic resources. So these are all affecting us, and it's all due to climate change. Emergence of COVID-19 has affected people with TB, especially because most of the people who have TB are more prone to COVID-19, the same with HIV, and the same with malaria. So these are all issues of climate change affecting my country and sub-Saharan Africa as a whole. Okay, so if you look at the work of civil society, we work more with the vulnerable population, persons affected with TB, HIV, and malaria. We also work with governments at different levels, but our niche is especially spending most of the time with the people, the vulnerable population. Now, because of the shrinking space for civil society and communities, resources are not reaching civil society to do their work. But I still believe that most civil society organizations have the structures that can contribute at community level to support and address issues of climate change. One of the things that civil society can do is to really create that awareness, education for human-related environmental distractions, and most of the time the vulnerable. We can also increase advocacy for government to increase domestic resources to support civil society interventions that actually support persons living with HIV, TB, malaria, and key population, and many other people that we are working with in our countries. I think climate change is something that has come to stay with us. The earlier we start addressing it with multi-sectorial partnership and approach, the better. Because the future is unpredictable. We don't know what disease that will come and kill many people and erode our gains. And just emergence of COVID-19, many countries are not able to even meet their debt. And because of that, government are struggling. Civil society, communities are all struggling. And it is very, very difficult for people to even afford their 3 square meals a day. And you know, there is a lot of non-communicable diseases. There is a lot of neglected tropical diseases that are all related to climate change. Because if you look at climate change and health, it is part of the problem that we are facing. And I think civil society have a very big role to play. Communities have a role to play at different levels. It is time for us to strengthen partnership with civil society and communities and invest adequately in the governance of civil society and communities to be able to contribute to climate change at all levels. We are with the people, they listen to us, we work with them, and civil society and communities are the best people to do that, to partner governments across the world to address these climate change challenges. We are in to support that. I think it is time to invest in institutions that really work with civil society and communities. And one of those institutions is the Global Fund. It has created that space for us. And Global Fund has really made a lot of gains in the lives of the vulnerable population that we have, key population, women, children, the young people, all affected by the 3 diseases. It is time that we increase domestic resources to ensure that sustainability of the interventions and the gains that civil society and governments, Global Fund and other partners do is sustainable and owned by the governments.